This next section starts with the pharmacist's right to refuse. So the pharmacist's right to refuse takes into consider our moral objections to a certain service, such as contraception or abortion, and must also take into account our ability to respect patients' rights and access to care. So if we refuse services, does the patient have another option, such as another pharmacist, another pharmacy, another location, in order to obtain the care that they choose to have? So conscience clauses allow healthcare providers to refuse certain services based on a personal belief. It's considered a constitutional right in order to be able to refuse certain services based on your personal beliefs, and it can be either moral, ethical, or religious reasons that you refuse the medical services. It applies to different medical providers, and pharmacists can control access to a certain degree with this. So APHA has a policy of pharmacist conscience clauses that was reaffirmed more recently that you can take a look at, but basically it says that it recognizes a pharmacist's right to exercise a conscientious refusal of certain services and supports an establishment of systems to ensure that patients access to legally prescribed therapy without compromising the pharmacist's right of conscientious refusal. So what does this mean? It means that the pharmacist can refuse certain services while at the same time making sure the patient has access to those services without compromising the pharmacist's ability to refuse. So certain states will have different legislation regarding this. Some of them take into account the provision of services for the patient, and some of them have legislation that doesn't take into account whether or not the patient has access to the services. So going to the New York State policy, this legislation says in the case of a pharmacist who has an objection to a certain type of medication or service, the pharmacist has a professional obligation to take appropriate steps in order to avoid abandoning or neglecting the patient. So this is not the case in every state. So depending on where you practice, you may or may not have to take these steps in order to provide access to the service for the patient. So let's say the pharmacist doesn't agree with dispensing of contraception. They have to make sure that they're always working with another pharmacist that is okay with dispensing contraception, or that the patient has access to another pharmacy where they can get those services where that drug will be dispensed. You do have to take into account where you're practicing in regards to this. So let's say you're in a rural area and there aren't a lot of pharmacies around. Will your refusal of the service or the medication put the patient at a disservice that they aren't able to get the medication filled at another pharmacy or from another pharmacist? So again, this is a balancing act between our own personal beliefs, either religious, moral, ethical, what have you, regarding the services, and following the law. So again, in New York State, the pharmacist has a professional obligation to take appropriate steps to avoid abandoning or neglecting the patient. So we can refuse services if we take those steps in New York. Other states, you don't have to take that additional step. In regards to minors, a minor is usually considered in between the ages of 12 and 18, but could vary depending on the state. They usually can't consent to their own health care, but when it comes to certain services related to pregnancy, childbirth, contraception, HIV and STI testing, family planning services, abortion, contraception, in certain states it'll vary how much they're allowed to consent for themselves. So when a minor seeks health care for a healthcare provider, we have to think about two different things. Is the type of care that they're seeking falling into one of the above categories? So does the minor have the ability to then give informed consent for that such health service? If the answer is yes to both, then the treatment should be confidential. So let's say in New York State, where all of these services a minor is allowed to give consent for without parental information. The teen can get care without involving their parents, and we are not allowed to involve the parents in terms of providing information. And if we do, the pharmacist could have their license suspended or revoked or be sued by the patient and their family. The healthcare provider can only provide information if either the teen gives permission for you to talk to, for example, the parents, and then I would document that, or for emergency treatment. So depending on the type of services, this will vary what the teen is allowed to provide consent for. So for example, contraceptive services, all minors less than 18 have the right to access contraceptives, and that was a U.S. Supreme Court decision. So no state has enacted any specific blanket requirement that requires parental consent for contraception. As it relates to some of these other services like STI, HIV, prenatal care, adoption, medical care for the child, and abortion, this might be different depending on what state you're in. So I included these. A lot of these resources are from the Guttmacher Institute, which some of the links are provided in your resources. But this table, they have a table about people younger than 18, so minors, and what they're allowed to consent to based on state. So you can see, depending on the state that you practice in or the state that you're from, what minors are allowed to consent to. I only included New York State since that's where we are, but in New York State, minors are allowed to consent to all of these different services, and they don't specifically have a law about abortion services. So if it is about abortion for minors, then sometimes it's up to the medical provider whether or not they feel that it's okay for the minor to consent to that. The final thing I want you to consider at the end of this lecture are these patient cases or scenarios that you might encounter as a pharmacist. What are some things to consider? So, for example, case 1, a 28-year-old married female comes into the pharmacy for a dose of Plan B after their condom broke about 3 hours ago. So what are some important things to consider about this case? The patient is not a minor. The patient is married. Maybe that's important to you. They're coming in for emergency contraception, and whether or not let's say they had a prescription for it, would you dispense that prescription to this patient? Or would you only dispense the prescription to certain other types of patients? Case 2, a 17-year-old single female, not in a monogamous relationship, comes in for Ella after unprotected intercourse. So important things to consider about this case. This is a minor. They're not in any sort of relationship, so are they in some sort of promiscuous relationship with different partners? They're coming in for a prescription for Ella, which in some circles is considered having the ability to interrupt pregnancy or prevent implantation. Case 3, a 12-year-old, so at the very low end of the minor scale, a single female comes in asking for emergency contraception. So could you tell the parents? What would you do for that patient in addition to locating the emergency contraception for them? Would they require some additional counseling perhaps from you? Or would you not direct them to the emergency contraception and say they have to get it elsewhere? Case 4, a 31-year-old presents after unprotected intercourse at a local pharmacy in a rural location for Plan B, but finds that the pharmacy does not stock it. So perhaps the pharmacist at this pharmacy does not, maybe it's an independent pharmacy, maybe they don't agree with it. What type of provision should we be making for this patient so that we're not considered abandoning or neglecting the patient? Case 5, 36-year-old female presents to the emergency department after she was raped. A lot of institutions, healthcare institutions such as hospitals, will have post-sexual assault kits that have STI, post-exposure prophylaxis, as well as pain medications and occasionally emergency contraception such as Plan B. So as a hospital pharmacist, would you be okay with dispensing the emergency contraception in this case, or would you not, regardless of the unprotected intercourse situation? Case 6, a 14-year-old, their mother presents to the pharmacy after finding birth control pills and wants to address a pharmacy regarding them. So can you say anything to this mother regarding the patient's birth control pills? They're considered a minor. This is contraceptive care. What would you do in that situation? And then case 7, a 36-year-old presents to the pharmacy with a prescription for misoprostol for the indication of a missed abortion. So remember, our terms, a missed abortion can often indicate a miscarriage. So and then also because she's only being prescribed misoprostol, this is more often a miscarriage rather than an elective abortion. So even though it says abortion on the prescription, we should consider that this is probably more likely a miscarriage. So that concludes the notes packet. I would advise you to review all of the resources as well as the workbook and these videos prior to attempting the quiz. And please contact me if you have any questions regarding any of this material. Thank you.